Hi there, welcome. I'm delighted to talk to you today about a very important topic, the topic of maintaining appropriate professional boundaries with patients. This topic is one that is probably the most common issue we find, and it happens a lot, and its impact can be very big. And because of the nature of the way that home health works, where we're in somebody's home, not in the community, you're not spending time in the office, you're spending time in people's homes, it's easy for boundaries to slip. And the fact that we also provide long-term services, long shifts, you're in the home, many of you, for 8 to 12 hours a day, in the family's home, not with other team members, it can become very easy for professional boundaries to be lost. This training to me is super important because if everyone is able to maintain their professional boundaries, then we can work together as a team. You'll be happiest as an employee. Ultimately, your patients will be happiest and most cared for, as well as their families. But this does require you to be firm and know what's appropriate and what's not. And sometimes I think it's easy to misunderstand what we mean by remarkable care and having professional boundaries. You can provide remarkable care and be an absolute professional. And going above and beyond in your duties is allowed. Going to a place that is inappropriate or emotionally beyond where you should go is not good for your patient, as much as you might think so in the moment. So we're going to talk about this, and I hope you really digest this, because this is not just a training that you're maybe going to have to, utilize. It's a training that you will have to utilize, most likely today if you're out in the field. So it's our responsibility. So nursing, caregiving, providing therapeutic services, OT, PT, speech, this is a valued and respected profession. These are valued and respected professions. And a special relationship and bond certainly forms between care providers and those in their care. So patients and families expect us to act in their best interests and respect their dignity, their privacy, and they also expect us, even if they don't fully say it, for us to do what's right and best for their well-being, and for us as a company to maintain a standard that allows for them to be served by not just you, but by the whole agency. This means that a nurse must abstain, nurse, home health aide, OT, PT, speech, social worker, must abstain from attaining personal gain at the patient's expense. It means a nurse or caregiver must refrain from jeopardizing the therapeutic relationship. So we're going to talk about the therapeutic relationship. This is not your best friend. That's a different kind of relationship. This is not your buddy. This is not your child. This is a therapeutic relationship that you are providing in conjunction with a company, Illume, where you have team members, where you have a role and you have a part of the puzzle of providing their care, and you are intended to play that role and allow the other people on your team to provide their role. And together we can provide remarkable care to a patient. But we can't do that if anybody's boundaries are out of whack and providing services or connections or behaviors that violate what is appropriate. So the therapeutic relationship is one that allows nurses, therapists, home health aides to apply your professional knowledge, skills, abilities, and experiences towards meeting the health and wellness needs of a patient. Okay? Health and wellness needs, that's why you're there. You want to know their situations. You want to help them in all the ways you can. But it needs to be in such a way that you can provide your professional knowledge, skills, and abilities, and what the company can provide, what we collectively can provide. This relationship is dynamic, goal-oriented, and patient and family-centered, because it's designed to meet the needs of the patient and the family. The therapeutic relationship protects the patient's dignity, autonomy, and privacy, and allows for the development of trust and respect. So, professional boundaries are the spaces between a nurse or a therapist or home health aide, between the nurse's power and the patient's vulnerability. Okay, so we go in and we are forming relationships with them. They have a certain level of vulnerability, and we have a certain level of power. So the power of the nurse comes from the nurse's professional position and access to sensitive personal information. So the difference in personal information the nurse knows about the patient versus the information the patient knows about the nurse can, just in the nature of it, create an imbalance. So nurses should make every effort to respect the power imbalance that exists. They're not in your house, seeing you in your home setting when you are needing services. They're not there. You are. So there's an imbalance. Their behaviors are reflective of where they are and their vulnerability. And you need to be very careful to not step over the boundaries of what their vulnerability is, or go into a place that they're pulling you. Sometimes you really have to pull back. Crossing boundaries. Boundary crossing are brief excursions across the professional lines of behavior that may be inadvertent, thoughtless, or it could be purposeful, and it's probably while attempting to meet a special therapeutic need of the patient. So it can result in the return to an established boundary, so it might happen and just quickly you realize it and move back, but should be evaluated by the nurse for potential adverse patient consequences and implications. Repeated boundary crossing should be avoided. They can result when there is confusion between the needs of the nurse and those of the patient. Okay, so excessive personal disclosure by the nurse, secrecy, or even reversal of roles can be common. Boundary violations can cause distress for the patient, even if they're not fully conscious of it, and it can also cause other harmful consequences to them. So you want to look at the continuum of professional behavior, right? You want to look at the balanced therapeutic relationship occurs somewhere between under-involvement and over-involvement. So every patient relationship that should be plotted in your own mind on the continuum of professional behavior, okay? Over-involvement includes boundary crossing, boundary violations, and professional sexual misconduct could be. Under-involvement includes patient abandonment, disinterest, neglect, and can be detrimental to the patient and the nurse. There's no definite line separating the therapeutic relationship. It is a gradient. So we have to really keep an eye on it because it's not black and white all the time. So questions to consider is, what is the intent of the boundary crossing? What was it? Was it for a therapeutic purpose? Was the patient's what's in the patient's best interest? Did it optimize or detract from the nursing care? Did the nurse consult with a supervisor or colleague? And was the incident appropriately documented? That's what we want to think about if we run into situations where you do cross a boundary. So professional boundaries, delineate and maintain boundaries. This is what you want to do. You want to work within the therapeutic relationship. You do not want to go into the relationships being that of a good friend, being that of mother-child, being that of any other relationship, frankly, other than your therapeutic relationship. Examine any boundary crossing, be aware of its potential, and avoid repeating. Being in a home health agency versus in a hospital increases your likelihood of boundary crossing. So bear in mind that specific difference. Actions that overstep established boundaries to meet the needs of the nurse are boundary violations. Avoid situations where he or she has a personal, professional, business relationship with a patient. You want to look out for that. We do not like the idea, and you should not have post-termination relationships with our patients, because there's a good likelihood we'll have relationships with them later. And that then creates a hard situation for you. So if you have a good friendship with someone and now you're taking care of them as a nurse or as a home health aide, it could very well be a problem in you being able to maintain your boundaries. So why are boundaries needed? Professional boundaries are necessary to perform your objective assessments and observations on the patient. So your eyes start to get colored. You can't see as clearly when you're seeing your patient as a friend, or as someone you have a crush on, or as someone who you love and adore so very, very much you see them almost as a child, like there's your child. Your ability to see them objectively, clinically, starts to dissipate, and that just can't happen. It's also important in order to carry out orders appropriately, right? You have to do what's in the doctor's orders, and you can't have any kind of things going on that might make you not want to. In order to make professional decisions, you have to have your boundaries. In order to provide the education that you need to. So you might need to show them how to do things they don't want to do. And that might be more difficult if you're coming to them more as a friend, right? Or you see them in a different way, it might be harder for you to provide education. And it's also necessary for you to be able to exercise good judgment to determine and meet the needs of the patient. You can't do that if your boundaries are off, if your relationship is out of sync. What's the impact? So violations in boundaries can impact clinical outcomes, no joke, patient satisfaction for sure. I promise, even if things are really good now, they're not good. They're only good until they're not. So you could be having this nice, very close connected relationship with someone, a mother, for example, of a sick child, and everything is hunky-dory between the two of you. You're sharing all kinds of personal information with each other until something happens. And then suddenly everything changes. Now their satisfaction with you completely changes. So boundary violations can impact many areas, including patient satisfaction, clinical outcomes, agency resource utilization, staff burnout, potential legal or risk or management issues also can happen out of boundary violations. I've seen this happen where a nurse gets very connected to a patient or family, and this number 3, where they get so connected to a particular patient or family that the family doesn't want anybody other than that nurse to work with them. And so they do whatever they can to keep that nurse, and then they want that nurse to work extra hours, overtime. It won't allow for other nurses to come in to cover that overtime. That is an indication that there is a boundary that is being violated. It's not allowing for the appropriate utilization of our resources to be applied because there's a boundary in place. So this is where these kinds of things do take place. So some red flags. Discussing personal problems with a patient or family. Just do not talk about yourself in the home. Really focus on having your conversations be clinical in nature, about the patient, their whatever their personal, how you're engaging with them. Don't tell them about details about your family. Don't tell them details certainly about your problems, your finances, what's happening with your kid who's sick or in the hospital or whatever. Don't share it. It's not appropriate. You're not there to talk to them about your family. You're there to talk about the patient, and you're there to focus on the patient. Engaging in behaviors that could reasonably be interpreted as flirting. Don't do that. We've had that, by the way. Accepting or giving gifts, it's not a good idea, folks. You know, our policy states we do not give or receive gifts. And it's also, it's a law. So we have to be very careful about that kind of thing. Keeping secrets with a patient, including withholding necessary information from other healthcare professionals or the family. I've seen this, I've seen a lot of this. So you get really close with mom and you start to hear certain things about the patient or whatever, and you don't want to, even though you know in the back of your mind something's being shared with you that should be shared with your case manager, with your supervisor, and for whatever reason you haven't. So that is a sign. Don't just share, be forthcoming and share whatever those things are, and so that you can make sure that those boundaries are stay intact. Sharing inappropriate humor or jokes with the family. No. Okay, silly jokes, no. Let's keep, you know, don't, you know, knock, knock, who's there? Boo, boo, hoo. Don't cry, it's only a joke. It's okay, but don't bring out the dirty stuff or inappropriate humor. Believing that no one else is competent or capable enough to meet the needs of the patient. This one happens a lot. We have to watch for this, right? Because we are a team. And if you do not allow for the team to support the patient, you have in your mind switched what your role is. And so it's really important that you allow for others to be part of the team and that you believe in your team. And it's really easy to forget that your team is there for you, and it's easy to get judgy about your team when you don't see them very much because you're primarily with the patient and with the family. It's very easy to get into a dangerous, circuitous conversations that will lead you into bad places. Don't do it. Just do not do it. Speaking poorly about colleagues or your employment setting or company with the patient or family. Don't do it. I can tell you it will not end well for you. It is a low consciousness way to connect with people, to commiserate. It just is. So if your family is unhappy, if the patient and their family is unhappy with something that's going on, your professional obligation, you have no ability to correct what another nurse is doing in the home. So don't perseverate with them on it. Say, I hear you, I will let my supervisor know. There's nothing else I am able to do about it. Don't allow yourself to connect with them about that commiseration, because it will not support and serve you. It doesn't help you to be part of the solution, right? You can be part of the solution by connecting with your supervisor, saying, hey, there's an issue. This other nurse who's on the case that seems to be having some issues with mom, and can somebody please help deal with that? That's how you deal with it. Not by saying, oh my gosh, really? Did she do that? Oh, that's terrible. Oh my goodness, you're right. And oh, the people in the office, they did that too? No. Thank you for sharing that with me. I will make sure that gets back to the appropriate supervisor. That's the response. That's what a professional does. Okay, showing favoritism. Visiting or calling a patient for non-medical reasons. Don't do it. Seen a lot of people do it. Don't do it. You think you're going the extra mile, showing up at their birthday parties, bringing them stuff. Don't do it, folks. Be aware of where your responsibilities are and how those steps across the line can affect your ability to support and serve them and be part of the team that you're on. Be very careful about that. If you're going to go to a patient's birthday party, call your supervisor and ask, first of all, if it's a good idea, and consider inviting 2 or 3 of the other nurses so that you're going together as a team and you're not going on your own, where you might step into a different role. Visit or calling a patient for non-medical reasons. Don't do it. Visiting a patient after discharge from the agency. Don't do it. I know that it happens. I've heard lots of stories of it. Do not do it. Lending personal items to patient or family. Not a good idea. All right. We know you're out there trying to do your best to support and serve them and trying to give to them whatever they possibly could need. Please bring it back to your supervisor. Invite Olume to be part of the solution with you. Performing special favors for a patient, like purchasing groceries, performing household chores, driving patient to appointments. Don't do it, right? So you have to be careful about those things. And you can provide remarkable care without going beyond what's appropriate in your role. Addressing a patient unprofessionally, like sweetheart or honey or darling, should be really carefully. You don't want to use those kinds of terms. It's a sign of disrespect, especially when you're working with the elderly. Very important not to do that. Inviting a patient or family member to personal social events. Imposing personal religious beliefs. Please don't talk about religion or politics in other people's homes. Not a good idea. Failing to address or resolve inappropriate or provocative comments from a patient or family member. So it's important to bring up any issues that come up in the home and to your supervisor. If there's something comes up that you're uncomfortable with, tell us, and we can start to deal with it. Flirting that occurs between a patient and family member and a clinician is a very, very dangerous thing to do. Don't do it. So ways clinicians cross boundaries: financial, inappropriate self-disclosure, super clinician, and non-clinical focused relationships. So it can happen that we've seen theft, inappropriate acceptance and giving of gifts, selling items to patients or caregivers. Don't sell items to your patient, and don't buy things from them. Offering financial advice or making financial decisions, not a good idea. Don't talk about your personal problems. Don't discuss, please, other patients. I've heard this so many times. You're in the house and then somebody brings up, oh, I was over at this other patient's and here's what happened. I've been to visit families, and families are appalled that their nurse was telling stories about the other patient they had seen the day before. That is not a good reflection. They know that you're also going to go and tell private information about them. Just be very careful about that. Discussing other staff members. It's not allowed. Imposing religious or personal beliefs. Please don't do that. The super clinician. We have a few of those. Insisting on making outpatient visits for a particular patient, assuming nobody else can do it, right? You have a team, you're part of a team, you need to let other people do their part. Insisting on performing all scheduled functions related to the patient, making negative comments to the patient about the skills of other clinicians. You might think you're being a part of the solution by hearing their concerns, but you're not. Unless you are empowered to fix the problem and you're there to listen to the problem so that you can be a source of solution, you should not be having the conversation with someone. Keeping secrets with the patient or caregiver. Failing to disclose changes in the patient's status with the physician or other members of the interdisciplinary team. Can't do that. Planning other patient visits around the needs of one patient. Taking calls from a patient after hours rather than directing them to the on-call nurse. Not a good idea. Putting down the agency or other care providers with the patient and family. Makes you feel like you're connecting to them, and in fact, it's just very unprofessional. Running errands for patients or caregivers, performing special favors, driving to patient to do errands, financing patients or caregiver expenses, calling the patient for non-clinical related reasons, visiting the patient outside of planned visits, non-clinical related activities during the visit, extending invitations. So what happens? Disciplinary action. Could be even reporting to a law enforcement agency or a licensure body, or possible loss of professional license. Don't do it. So, ways to avoid it: establish boundaries up front. Ongoing professional boundaries education. Just know that this this education's here for you, and there'll be others as well. Support improved work-life balance. It's part of that, like, okay, you're done with the patient. After your shift, you set some boundaries. You go home and you let that patient call the nurse on call or deal with the nurse that's in their home. It's not about you being there for all the things, right? Support your own improved work-life balance. Have boundaries. Increase involvement of the interdisciplinary team. Set limits related to acceptable role and responsibility in the patient's plan of care. Develop and strengthen communication skills, right? That's part of that, like listening and knowing when it's inappropriate, not feeding into gossip. Gossip, you might think you're listening and connecting, but you're really gossiping and stirring up the pot. Lean on your supervisor and office team to address whatever problems arise within your patient family. That's how to avoid trouble. Okay, all right, wasn't that a cheerful topic? All right, so thank you for this time to connect and talk about boundaries. And if you have any questions, seriously, please let us know. Let me know, let the administrator know, let your supervisor of clinical services know. This is serious business, and we want to make sure you're protected and that you're aware of what's appropriate and what's not. All right, in the meantime, go make the world a better place. Thank you.